Meningitis is a serious infection disease that causes inflammation in the protective membranes covering the brain and spinal cord. Meningitis caused by viruses, bacteria, fungi, and parasites. The most common types are viral and bacterial meningitis. Bacterial meningitis is a very serious type of meningitis and can be fatal within 24 hours. Around 1 in 6 people who get this type of meningitis die, and 1 in 5 have severe complications. According to WHO, 1.2 million cases of bacterial meningitis globally each year, resulting in around 135,000 deaths. It affects all ages. Young children and newborn babies are at most risk. Common symptoms of meningitis include fever, headache, stiff neck, sensitivity to light, nausea, vomiting, and confusion. Symptoms: in babies, irritability, poor feeding, high-pitched crying, and a soft spot on the head. Meningitis outbreaks often occur in densely populated areas, particularly unvaccinated. Sub-Saharan Africa is particularly affected by this disease. Meningitis treatment varies. Viral cases often improve with rest. Bacterial requires urgent antibiotics, while fungal or other types may need specific medication. Lyme disease. Infectious disease is usually transmitted from an infected deer tick. These ticks are often the size of a poppy seed and leave no visible bite mark. Lyme disease was first identified in 1975 in Lyme, Connecticut, and is named after the town. It affects over 300,000 people annually in the U.S., with children aged 5 to 9 being the most affected, accounting for around 200 cases daily. Its symptoms include fever, headache, fatigue, and a characteristic skin rash called erythema migrans. However, this rash only occurs in 70% to 80% of infected people. If left untreated, infection can spread to joints, the heart, and the nervous system. Lyme disease outbreaks are most common in wooded and grassy areas where ticks thrive, particularly in regions of the United States, Europe, and Asia. Ticks are most active during the warmer months, from spring to fall, increasing the risk of exposure during outdoor activities. Leptospirosis. It's estimated that more than 1 million people worldwide get leptospirosis each year. Almost 60,000 of those die from it. Leptospirosis is caused by the bacteria Leptospira, entering the body through mouth, nose, eyes, or skin breaks, traveling through blood to kidneys, where they exit in urine, potentially spreading the disease to others. It's often transmitted to humans through contact with water, soil, or food contaminated with the urine of infected animals, particularly rodents. Common leptospirosis symptoms include high fever, headache, muscle aches, chills, and red eyes. Leptospirosis consists of 2 phases: the leptospiremic acute phase and the immune delayed phase. An acute phase with flu-like symptoms occurring 2 to 14 days post-infection, lasting 3 to 10 days. In the immune phase of leptospirosis, bacteria move to organs, mainly kidneys, detected through urine tests, with potential severe complications like Weil's syndrome causing internal bleeding, kidney damage, and jaundice. Leptospirosis is treated with antibiotics, usually in the form of oral medication. Pertussis, also known as whooping cough, is a highly contagious respiratory disease caused by the bacterium Bordetella pertussis. Pertussis is spread through respiratory droplets when an infected person coughs or sneezes. The bacteria attach to the lining of the airways in the throat and produce toxins that lead to inflammation and characteristic coughing fits. According to WHO, 16 million cases of pertussis worldwide each year, resulting in about 195,000 deaths. The first symptoms appear 7 to 10 days after infection, such as common cold, runny nose, sneezing, and mild cough. As the infection progresses, severe coughing spells develop, often followed by a whooping sound when trying to breathe in after coughing. Infants less than 6 months old are at the highest risk of severe complications and death from pertussis. Infants may not cough, but instead have difficulty breathing, leading to episodes of apnea, pauses in breathing. People with pertussis are most contagious for about 3 weeks after cough onset, and coughing spells may last 4 to 8 weeks. Azithromycin or erythromycin antibiotics relieve symptoms and halt spread, while rest, hydration, and humidified air provide comfort in whooping cough treatment. Measles is a highly infectious viral infection that primarily affects children. Measles is caused by the measles virus, which is spread through respiratory droplets when an infected person coughs or sneezes. It can also be transmitted by touching surfaces contaminated with the virus and then touching the nose, mouth, or eyes. Symptoms of measles typically appear around 10 to 14 days after exposure and include high fever, cough, runny nose, red eyes, and a distinctive rash that starts on the face and spreads to the rest of the body. An estimated 869,770 measles-related deaths worldwide in 2019, mostly among children under the age of 5. In measles outbreak, 2022 cases have increased by 18%, and deaths have increased by 43% globally as compared to 2021. Cholera is a serious infectious disease that causes severe diarrhea and dehydration. It's usually caused by drinking water or eating food contaminated with the bacterium Vibrio cholerae. The bacterium Vibrio cholerae produces toxins that cause the characteristic symptoms of cholera. Symptoms of cholera include watery diarrhea, vomiting, and leg cramps. The diarrhea is often described as rice water stools due to its pale and watery appearance. Severe dehydration can occur rapidly, leading to sunken eyes, dry mouth, rapid heart rate, and low blood pressure. According to WHO, there are an estimated 1.3 to 4 million cases of cholera worldwide each year, leading to 21,000 to 143,000 deaths. The worst cholera outbreak by mortality rate struck London in 1854, killing over 5% of infected people. Cholera is primarily treated with oral rehydration therapy, supplemented by intravenous fluids and antibiotics for severe cases to manage dehydration and infection spread. Chikungunya, caused by the Chikungunya virus transmitted primarily bite by infected Aedes mosquitoes, results in severe joint pain, originating from the Makonde word meaning to become contorted. In symptomatic patients, disease starts typically 4 to 8 days after the bite of an infected mosquito. Symptoms of chikungunya typically include sudden beginning of fever, joint pain, especially in the hands, wrists, ankles, and feet, muscle pain, headache, fatigue, and rash. Some patients also experience nausea, vomiting, and red eyes. Dengue and Zika have similar symptoms to chikungunya, making chikungunya easy to misdiagnose. No approved vaccine or specific treatment exists for chikungunya virus infections. Management focuses on symptom relief with rest, fluids, and over-the-counter pain relievers like acetaminophen or ibuprofen to alleviate fever and joint pain. While chikungunya is not usually fatal, prevention involves avoiding mosquito bites with repellents, long clothing, and nets. Rotavirus infection is a very contagious infection that affects the stomach and intestines, causing diarrhea and vomiting, especially in babies and young children. Before the development of a vaccine, most children had been infected with the virus at least once by age 5, and an estimated 215,000 deaths annually in children under 5 years old, mostly in low-income countries. Rotavirus, easily spread from person to person, primarily through contact with infected stool or contaminated surfaces, causes the disease. Symptoms of rotavirus infection include watery diarrhea, vomiting, fever, and stomach pain. These symptoms can be especially severe in young children and infants, leading to dehydration, which can be dangerous if not treated promptly. Treatment for rotavirus infection focuses on preventing dehydration by drinking plenty of fluids, including oral rehydration solutions. In severe cases, hospitalization may be necessary to receive intravenous fluids and electrolytes. Leprosy, also known as Hansen's disease, is caused by the bacterium Mycobacterium leprae. The symptoms of leprosy develop slowly over years. The most common leprosy symptoms include painless skin lesions, loss of sensation in the hands and feet, muscle weakness, and eye problems. Historically, leprosy has been one of the most stigmatized diseases, with sufferers disliked from society due to misconceptions about its contagiousness. In past, if someone had leprosy, they were pushed away from society and made to live in special places with other sick people. People were afraid they might get sick too. Today, leprosy is treatable with multi-drug therapy, but delayed diagnosis and treatment can result in permanent disability. Ebola. The Ebola virus, a highly fatal and scary disease, gained its notorious reputation due to its severe symptoms, including bleeding from multiple body organs. This virus attacks the body's immune and vascular systems, causing widespread damage. Victims often experience symptoms like fever, fatigue, muscle pain, and intense headaches before progressing to more severe stages. In 2014, there was a case where a man accidentally ate meat that was contaminated meat. The next day, he started showing signs of Ebola, like fever and bleeding from his eyes, nose, and gums. The virus damages blood vessels, causing bleeding. The body tries to fight it with a big response called a cytokine storm. Ebola is very deadly, with 9 out of 10 people who get it not surviving. Ebola has had many outbreaks in Africa. The biggest one was in West Africa from 2014 to 2016. It led to over 28,000 people getting sick and more than 11,000 people died. Tuberculosis. Tuberculosis is a dangerous infectious disease that usually attacks the lungs. It's caused by Mycobacterium tuberculosis, which spreads through the air when someone with it coughs or sneezes. Imagine it's 1895 and you start coughing really badly for weeks. Your chest hurts more and more and you start coughing up blood. You feel extremely tired, have a high fever, and sweat a lot at night. The disease slowly eats away at your lungs from the inside. When you die, doctors see that your lungs look like holy cheese because bacteria have eaten them up. To treat this disease, you need a 6-month-long treatment that can have many bad effects. If you get this disease, there's a 60% chance you won't survive. Yellow fever. Yellow fever is a serious sickness caused by a virus spread by mosquitoes. Symptoms include fever, headache, body ache, fatigue, nausea, vomiting, and more severe ones like very high fever, yellow skin and eyes, bleeding, shock, liver and kidney failure, and even death. About 30% to 60% of people with severe yellow fever die. In the past, it caused big outbreaks in Africa, South America, and the Caribbean, where there are lots of mosquitoes. Around 200,000 people get infected each year, with about 30,000 deaths, mostly in Africa. There is no specific antiviral drug for yellow fever. Patients should rest, stay hydrated, and seek medical advice, but vaccines can prevent it.